Good afternoon.
Good afternoon. Hi, it's Malka Stromer
And Janine Noble.
with Sound Sports Imaging. Here today, we are going to be doing our webinar on point-of-care ultrasound, scanning of the gallbladder and the kidneys. We're going to start off with a little presentation, and then I will demonstrate to you techniques to find the gallbladder and the kidneys. So let's get started. Okay, let's talk about the gallbladder. The gallbladder is a reservoir for bile. It lives in the right upper quadrant, inferior and posterior to the liver, lateral to the duodenum, possibly anterior to the hepatic flexure, and most importantly, it lives inferior to the right portal vein. When we scan, we're going to be looking for the landmark of the right portal vein, and we will show you, once you find the right portal vein, if you scan inferior to that, you will detect the gallbladder. When we're assessing the gallbladder, we need to assess the wall of the gallbladder as well as the lumen of the gallbladder. The wall has an inner mucosa, a middle smooth muscle layer, and an outer mucosal layer. It's important to note whether your patient is fasting or non-fasting, as the wall of the gallbladder will change in size depending on that. For a fasting patient, the wall will be nice and thin and echogenic. For a patient that hasn't been fasting, the wall can get up to about 3 millimeters in size because the gallbladder has contracted. When we're assessing the lumen of the gallbladder should be nice and anechoic. It is fluid-filled. If it is not anechoic, we are going to assess the echogenicities within the lumen. Is there shadowing? Is there layering for sludge? Is anything within the gallbladder mobile? When we're assessing the wall, we need to assess if it is too thin. Is the gallbladder wall distended? Is the gallbladder distended? Is the wall too thick? If it's thickened, is there symmetrical or asymmetrical thickening? And if you recall back, the normal gallbladder wall thickness is 3 millimeters or less, depending on whether the patient is fasting or not. Here are a couple of images of the gallbladder. The first image here is a gallbladder in cross-section. A round circle, you can see the anechoic lumen and a bright echogenic wall. Here is a long image of the gallbladder. Again, nice long length. We can visualize from the neck to the body to the fundus of the gallbladder with a nice thin echogenic wall, and again, a clear anechoic lumen. This image may be acquired in an oblique angle to the patient, depending on the lie of the gallbladder in the patient's abdomen. Let's look at the kidneys. The echogenicity of the kidneys is quite important. There are multiple echogenicities that make up a normal characteristics of the kidney. The renal capsule is an outer echogenic line, and it provides the kidney with nice smooth contour. The cortex of the kidney is the largest component of the renal parenchyma, and it is a hypoechoic echogenicity to isoechoic echogenicity when we compare to the neighboring liver for the right side. We can also compare the left kidney to the spleen, and that will also be hypo to isoechoic to the spleen. The medulla or pyramids are less echogenic than the cortex, meaning they are hypoechoic to anechoic with regards to the cortex, and they are evenly distributed around the parenchyma. The central echo within the kidney is the renal sinus, and the renal sinus appears quite bright, so it's hyperechoic to the cortex as well as to the liver or spleen. It contains fat, blood vessels, nerves, and calyces live in the renal sinus. This is a demonstration, a recall of the renal vessels that start from the main renal artery and get smaller right up into the interlobular artery. And then from the interlobular vein, blood is taken back eventually to the main renal vein, as you can see here. Renal size. The typical length of an adult kidney is about 9 to 12 centimeters in length. It is most important, however, to be able to compare the left kidney to the right kidney. They should be within 2 centimeters of each other. That demonstrates good symmetry and lets us know that these are probably good, healthy kidneys within the 9 to 12 centimeter range, symmetrically from left to right. Pediatric kidneys resemble an adult kidney by 6 months of age. However, there is less renal sinus fat in the pediatric population. As a patient grows in age and gets older, the amount of renal sinus fat increases. So the central portion of the kidney will get brighter with age. We also may see some prominent lobulations of the kidney. It may not be as smooth or have as smooth a contour as an adult kidney. Here are some images of the right kidney. As you can see, there's a bright echo around this kidney that represents the capsule of the kidney. You can see this hypoechoic echo. This is the renal cortex, and it's hypoechoic to the adjacent liver. In the central portion of the kidney here, you can see a very bright echo. That is the renal sinus and renal sinus fat. You can also see some more hypo to anechoic areas around the kidney. Those are the pyramids. This image here is a cross-section of the right kidney at the level of the renal hilum. And you can see the blood vessels going in and out of that kidney there. We call this the open donut shot. As you can see, there's the cortex surrounding the kidney is hypoechoic to isoechoic to the liver, and then the bright echogenic renal sinus fat. The left kidney is somewhat more challenging because of the fact that we may not have as good a window that we do with the right kidney. This is because with the right kidney, we're able to utilize the liver as a window to scan through to best visualize the kidney. On the left side, we don't have that. We do have a spleen, but depending on the size of the spleen, we may not be able to optimize the kidney as well. So it makes it a little bit more challenging on the left side. However, these are great images. This is a long image of the left kidney. Again, you can see the different echo textures, hypoechoic renal cortex. You can see the pyramids distributed throughout and the bright echogenic renal sinus. As well, we have a cross-section of the left kidney here, right at the renal hilum. You can see that's the open donut. And again, the renal hilum actually is anteromedial aspect of the kidney. And so depending on what window you're coming from, you can detect an anterior medial renal hilum. Again, as always, if you have any questions or want to learn more, you can contact us at info@soundsportsimaging.com or check us out on our website, www.soundsportsimaging.com. If you have any questions throughout this webinar, please leave those to the end and we'll be happy to answer those. Right now, we are going to start scanning, and I will show you or demonstrate to you the way to visualize the gallbladder and the kidneys. This one. There we are. Okay. So here we are. You see this abdomen right here. Okay. Well, we're gonna. So we're just gonna make sure we got the right orientation. This is going to be maybe warm. All right. So we're gonna start the center here. I'm gonna just adjust our depth a little bit. Perfect. Okay. Okay, so we're gonna ask our patient to take a deep breath in. Hold your breath there. Okay, we're actually way up at the heart, so you can see that pumping now. And we're gonna come down lower to the level of the hepatic veins, which are right there. And come down, now we see a bright echo with an anechoic center. That's the left portal vein. And as we come down towards the right, we can actually see a line coming across the screen there. That's the right portal vein. Breathe normally. Okay. What I'm going to ask the patient to do now is actually turn over onto their left-hand side. And what this will do is will allow us to optimize our window by having the liver fall down over the anatomy that we're taking a look at. So we're going to start again. Deep breath in, hold. Okay, so we're up really high. We can see hepatic veins, left portal vein, coming down a bit to the right, and there is the right portal vein coming across the screen there. And as we come inferior to that, boom, we hit a anechoic hole, which is the gallbladder, okay? So as I said, as always, just inferior to the right portal vein, we'll see the gallbladder. Just breathe normally. Perfect. Okay, so that's great. We'll take another deep breath in, hold. Okay, so here is actually a nice length of the gallbladder. We'll turn a little bit on it. And this patient's gallbladder kind of sits a little oblique in their abdomen. But we can see, and we're going to scan to the liver surface, back to the center, and then to the bowel surface. And see a nice, clear anechoic lumen and a bright wall. Perfect. Good. Relax. Okay, since they're already up on their side, we're going to leave that there. I'm going to add a little bit more gel, and we're going to look at the right kidney. Okay, so if we put our probe down here, it's beautiful. Okay, we can see, let's take a deep breath again. Hold. Gorgeous. Okay. And just relax. Perfect. Okay. Take a deep breath again. Hold it there. Yeah, this is beautiful. This patient actually has, good, relax right there. Okay, so as you can see here, okay, this is the patient's liver. You can see that the cortex of the liver is isoechoic to the cortex of the liver. Cortex of the kidney is isoechoic to the liver. There's actually a little renal cyst on this patient. It's outside the cortex, so those are very, very common, especially in gentlemen. So we have a cortex, we have a very bright renal sinus, and you can see tiny little echoes and echogenicities around. Those are the pyramids. Okay, so we'll unfreeze that. Okay, take a deep breath again. Hold. Okay, so now we're coming from the liver, coming down to the upper pole of this kidney. This is a closed donut shot. Now we have an open donut, that's the renal hilum, and coming down more inferior, the lower pole of the kidney, there's the little cyst, and we're out of it. Good. Breathe normally. So those are great techniques, beautiful scan of the right kidney. Okay, now what we're going to do is we're going to just take some paper towel here, and we're going to ask our patient to turn towards us. Okay, this is the best, if your patient is mobile, this is the best opportunity to visualize the left kidney. Okay, so the other thing to note is that the left side tends to be a lot more sensitive than the right side. So make sure to tell your patient that the jelly may be a little cold, maybe a little cold on this side. Okay. So we're going to, now, I like to put the transducer in between the ribs and the hip. And we should be able to visualize the kidney. Now, if we're visualizing, if we're too high, which is where we are right now, you're actually visualizing the spleen, which is right there. This is the spleen, okay? And now if I angle a little more inferior, you can see actually the spleen-kidney interface right here, which is beautiful. Like so. Perfect. So that is spleen-kidney interface right here. Okay, and so again, as we see on the right side, we see, take a breath in, small breath in, hold it there. Okay, so this is really nice. We see a long length of the left kidney. Okay, we're scanning through that. You can see the cortex as hypoechoic. I'm just going to freeze it right here. Good, relax. Okay, so the hypoechoic cortex, hypo to isoechoic to the spleen right here, and this is the echogenic center. Okay, you can also see some little anechogenicities. Those are the pyramids. Okay, so take a breath in again. Hold. All right. So we see nice left kidney. We're going to scan through it from side to side, and then we can go in cross section, and you can see those are rib shadows we're visualizing. So we want to put the kidney in between those rib shadows, which you can see right now, and we're going to scan through. There's the open donut, and all that's gorgeous, all the way through to the inferior pole of that kidney. Excellent, just relax. Okay, I want to show you one last technique before we finish up here. If your patient cannot move as much, and I want to show you how posterior you have to be. So you can lie back on your back, flat on your back. I'm just going to come side here. As you can see, so what I'm doing now is I'm coming from the side, and this kidney is great. Take a deep breath in. Hold. So I'm right up at the side here, spleen, kidney interface, but you have to come quite posterior to be able to visualize this kidney, okay? But this is very nice. If we can freeze it there, that would be great. Good. And so we're seeing a nice left kidney. All right. We're all finished with looking at the gallbladder and kidneys. So we want to thank you for joining us today. As always, Sound Sports Imaging provides solutions to all your ultrasound needs. Have a great day.
Thank you.